Have you ever felt mild abdominal pain and thought, it's just gas? Or have you noticed bloating that looks like fluid retention and simply ignored it? What if I told you that these seemingly harmless signs can hide one of the most deadly and silent diseases among women?
Ovarian cancer.
It's called the silent killer because it disguises itself as common symptoms, making thousands of women believe everything is fine until it's too late. And here's the truth that almost no one talks about. Most people only discover it when it's already in an advanced stage. But don't worry. Today you'll have access to information that can literally save lives. In this video, I'll reveal 10 strange, often ignored signs that could indicate ovarian cancer. These are symptoms that most women treat as normal, but which may be crying out for medical attention. And pay attention. At the end, I'll show you a simple test that can detect ovarian cancer early, even if you don't feel anything unusual. Before continuing, please comment here which country you're watching from. This helps our message reach more women around the world. And if this content already seems important to you, please like the video so the algorithm can share this information with those who desperately need it. Get ready, because the signs you're about to discover can change the way you see your body. If you're new here, please like, subscribe to the channel, and activate the bell to receive all our natural tips. This helps us continue offering you useful and accessible content. And tell me in the comments, which city or state are you watching from? First sign: constant abdominal bloating. Even if you don't eat much, feeling bloated from time to time can seem normal. After a heavy meal or during the menstrual cycle, many women notice abdominal bloating. But be careful. If this bloating occurs almost daily, even without overeating, it could be a silent sign of ovarian cancer. An ovarian tumor can develop inside the abdomen without causing severe pain at first. As it grows, it begins to produce inflammatory fluids, gas, and even compress nearby organs. The result? A feeling of abdominal bloating that doesn't go away over time. And that's precisely where the danger lies. Many women believe it's just gas, fluid retention, or menopause. But if you notice that your clothes are tight for no reason, or that your abdomen repeatedly feels hard and tense, you should take it seriously. A study published in the journal Cancer revealed that more than 70% of women diagnosed with ovarian cancer reported persistent bloating as one of their first symptoms. The problem? Most didn't pay attention until it was too late. The warning sign is clear. Bloating that lasts more than 2 weeks, worsens over time, and doesn't improve with diet or gas medications. Mention the word bloating in the comments if you've ever had a swollen abdomen for days without a clear explanation. This may help other women avoid ignoring this symptom. Second sign: persistent pelvic or abdominal pain. Do you experience discomfort in your lower abdomen without knowing where it's coming from? Is it a dull, cramping, pressure-like pain that persists for days or even weeks? This could be a warning sign that something abnormal is happening in your ovaries. In its early stages, ovarian cancer can cause internal inflammation or tumor growth, which puts direct pressure on the pelvic region. Because the ovaries are located deep in the abdomen, this pain is usually not sharp, but rather constant, uncomfortable, and easy to ignore. Many women believe it's a hormonal, intestinal, or even muscular problem. But if it's a new pain that appears for no apparent reason and doesn't improve even with common pain relievers, it's time to investigate. It's essential to know the difference. If the pain only occurs during menstruation, it's probably not cancer. But if it occurs outside of the menstrual cycle, becomes frequent, and is unexplained, further attention is required. Furthermore, if this pain is accompanied by bloating, bowel changes, or fatigue, suspicion intensifies. Signs to watch for: constant pain in the pelvis or lower abdomen, a feeling of internal pressure, persistent cramping unrelated to the menstrual cycle. Third sign: urgent or frequent need to urinate without infection. Have you noticed that you go to the bathroom more often than usual? Or that you suddenly feel the urge to urinate even after having just a few drinks? This symptom, often dismissed as a simple, sensitive bladder, may be related to something more serious. As it grows, ovarian cancer can press on nearby organs, such as the bladder. This pressure creates the sensation of a constant need to urinate, even when the bladder is not full. In some cases, it can even cause small leaks when coughing, laughing, or exercising. The problem is that many women associate this symptom with urinary tract infections, menopause, or aging. However, if the urine test shows no bacteria, there is no fever, and the discomfort persists, it should be a red flag. It could be coming from the ovaries. The danger lies precisely in downplaying this change, thinking it's simply due to aging or an overactive bladder delays diagnosis.
Warning signs.
Going to the bathroom more than 8 times a day without increasing fluid intake. Getting up several times during the night to urinate. Feeling that the bladder never empties completely. Constant pressure in the bladder or pelvic region. If the doctor rules out a urinary tract infection and the symptom persists, request further testing.
Don't ignore it.
Fourth sign, sudden changes in bowel movements. One of the most overlooked symptoms of ovarian cancer is persistent changes in bowel habits. It may seem due to a poor diet, stress, or the effects of medication, but sometimes it's the body sending warning signals. As the ovarian tumor grows, it can press on the large intestine and disrupt its function. The result, sudden constipation, diarrhea unrelated to food, painful gas, or even the sensation of incomplete bowel movements. This is commonly attributed to food intolerance, irritable bowel syndrome, or nervousness. However, if these changes are recent, persistent, and unexplained, further investigation is necessary. According to the American Ovarian Cancer Foundation, up to 30% of women diagnosed with this condition report changes in bowel rhythm as one of their first symptoms. Unfortunately, these signs are often mistaken for common digestive problems, delaying diagnosis. Signs to watch for. More than 3 days without a bowel movement, with no history of constipation. Alternating diarrhea and constipation without a clear pattern. Frequent or painful gas. A feeling of incomplete bowel movements.
Constant bloating.
If these changes are accompanied by bloating, pelvic pain, or loss of appetite, the combination of these signs should be taken very seriously. Fifth sign, feeling full quickly and losing your appetite. Have you felt satisfied after just a few bites and couldn't finish a meal? Or have you lost interest in food while on a diet, stressed, or ill? Although these symptoms may seem simple, they could indicate the growth of a tumor in the abdominal region. When ovarian cancer presses on the stomach, it causes premature satiety. In addition, the inflammatory processes associated with cancer can alter metabolism and naturally reduce appetite. Many women attribute this to menopause, hormonal changes, or simply a lack of appetite. But if this change is new to you and occurs for no apparent reason, it's a sign you shouldn't ignore. A study by the National Cancer Institute showed that more than 60% of women diagnosed with ovarian cancer reported loss of appetite or premature satiety before diagnosis. The problem is that this symptom often goes unnoticed for weeks or even months, especially because it is not usually accompanied by pain.
Warning signs.
Feeling full before finishing a normal meal. Sudden loss of appetite. Rejection of foods you previously enjoyed. A feeling of stomach tightness for several days. If this is accompanied by bloating, pelvic pain, or bowel changes, it is essential to consult a specialized gynecologist. Mention the word appetite if you have ever experienced an unexplained loss of appetite. Your experience may alert other women not to ignore this sign. Sixth sign, pain during sex. Although many women are embarrassed to talk about it, pain during sex can be an important and often ignored symptom. This pain, called dyspareunia, can manifest as a deep ache, uncomfortable pressure, or even sharp pains. Of course, there are several possible causes, such as vaginal dryness or infections. But when the pain appears suddenly, persists, and has no clear cause, it is worth investigating. Ovarian cancer can cause internal inflammation, alter the anatomy of nearby organs, and increase tissue sensitivity. This makes a previously pleasurable intimate relationship become painful. This pain is often mistaken for emotional, hormonal, or stress-related problems. But if it doesn't improve with lubricants or common gynecological treatments, it's time to seek a more in-depth diagnosis. And if it is accompanied by other signs such as bloating, changes in urination, or loss of appetite, the risk increases even more. Warning signs include internal pain during penetration, discomfort that worsens over time, a feeling of pressure or deep burning, and avoiding intimate contact due to the constant pain. Seventh sign, abnormal or irregular vaginal bleeding. One of the most alarming, yet most overlooked, signs is unexpected vaginal bleeding, especially in postmenopausal women. Any bleeding outside the normal cycle is a red flag. In women of childbearing age, this can manifest as bleeding between periods, heavier periods, or periods that are longer than usual. In menopausal women, even minor pink, brown, or reddish spotting should be investigated immediately. A tumor in the ovaries can affect hormone production, inflame tissues, and even reach nearby structures, causing unexplained bleeding. The problem is that it is often downplayed. It is attributed to stress, physical exertion, or even medications. However, according to studies conducted in the U.S., about 15% of women diagnosed with ovarian cancer experienced abnormal bleeding as one of the first signs. Warning signs: irregular bleeding, brown or pink discharge after menopause, spotting for no apparent reason, longer or heavier periods than usual. Comment on the word bleeding if you've experienced something similar. It may help other women not ignore the same symptom. Eighth sign, unintentional weight loss. Losing weight effortlessly may seem like a given, but when it occurs without changes in diet or physical activity, it's a worrying sign. Ovarian cancer, like other cancers, can speed up metabolism and consume energy from the body even at rest. Additionally, it can disrupt digestion and nutrient absorption, causing rapid weight loss. Loss of appetite, which we've already seen as a symptom, associated with digestive discomfort, nausea, and bloating, can lead to sudden weight loss in a short period of time. According to the National Cancer Institute, more than 40% of women diagnosed with ovarian cancer had already experienced unexplained weight loss prior to diagnosis. Warning signs: unexplained weight loss of more than 4 or 5 kilograms in up to 2 months, loose clothing even without dieting, weight loss accompanied by fatigue, visible loss of muscle mass in arms, legs, or face. Ninth sign, extreme fatigue that doesn't improve with rest. Fatigue after a busy day is normal. But when fatigue is constant, profound, and doesn't improve even with sleep, it could be that the body is fighting something more serious. Cancer-related fatigue isn't just a lack of energy. It's a physical and mental exhaustion that limits simple activities and is accompanied by weakness, lack of concentration, and excessive sleepiness. This happens because the tumor consumes nutrients, disrupts hormones, weakens the immune system, and can cause anemia. A study published in the Journal of Clinical Oncology showed that more than half of women with early-stage ovarian cancer reported persistent fatigue before diagnosis, but none suspected it could be so serious. Warning signs: feeling exhausted upon waking, needing to rest several times a day, lack of energy for simple tasks, and a constant feeling of heaviness. 10th sign: frequent nausea or digestive discomfort without apparent cause. Persistent nausea, as if suffering from perpetual indigestion, can also be a sign of ovarian cancer. The tumor can press on the stomach and intestines or release substances that affect the digestive system. The result: nausea, reflux, loss of taste, and even occasional vomiting. The problem is that this symptom is rarely associated with the reproductive system. Many women only see gastroenterologists, which delays a correct diagnosis. Warning signs: unexplained daily nausea, aversions to foods that were previously normal, stomach discomfort that doesn't improve with antacids, occasional vomiting for no apparent reason. Comment nausea if you've ever experienced this discomfort without apparent cause. Extra tight clothing around the abdomen. Many women report that, before diagnosis, they began to notice that their clothing was pinching their waist without having gained any weight. This symptom is related to ascites, a buildup of fluid in the abdomen caused by tumor inflammation. At first, it may seem like simple bloating. But when clothes no longer fit properly without significant weight gain, it's a sign that something is happening inside. Signs to watch for: pants and skirts that don't fit, a feeling of a hard abdomen even when fasting, a slow and steady increase in abdominal circumference. Signs to watch for: clothes that once fit well now pinch the waist or abdomen, a feeling of a hard stomach without having eaten much, the need to unbutton pants after only a few hours of wearing them, a slight but steady increase in abdominal circumference. This type of physical change may be one of the few visible signs in the early stages of ovarian cancer. Therefore, Observing your own body and realizing what was once normal but is no longer normal can save your life. Did you like today's tips? Then give the channel a like, or if you haven't already, subscribe to the channel and click the bell to continue receiving content like this. And let me know in the comments, what city or state are you watching from? See you in the next video.
Cheers, and see you later.